A massive rush hour traffic mess on southbound I-71 near the Lytle Tunnel. Now, right now, you're looking at a live shot of the situation from just outside the tunnel. On impact, the truck jackknifed, puncturing the tank and spilling more than 200 gallons of fuel across the highway. While emergency crews tried to clean up the mess, authorities shut down both sides of the highway from Fort Washington Way past the Lytle Tunnel. Right now, northbound I-71 is closed to all traffic south of the tunnel. Southbound I-71 is down to one lane. Now, no injuries were reported in that accident.
There's a special group of people at University Hospital who have to deal with horrible injuries nearly every day. They're the flying medical team at University Hospital known as Air Care. In this News Channel 5 Extra, Marty Peratt shows us how these helicopters take critically injured people on the ride of their lives.
They have saved lives and changed the way we handle life-threatening emergencies in the tri-state. They are the doctors, nurses, pilots, and crew of University Air Care.
By flying on Air Care and by having the helicopter available, we can basically bring the emergency room to the patient rather than have the patient wait to get to the emergency room. On the aircraft, we have the capability of doing advanced airway procedures, getting a patient's blood pressure back a lot quicker than would otherwise be available with ground crews and paramedics.
These two choppers cost about $1 million each, but they are priceless to the hundreds of patients who may have been saved by its quick, quality service.
It made a difference in my life. It made me a whole lot respectful of life. And it gave me a chance. It gave me a chance of living. Like I said, the people at Air Care were so professional, so unique on their approach and the way they handled the whole situation. They were on top of things, and it was bam, bam, bam. I was in, I was gone, I was in the hospital.
Air Care opened for business 7 years ago this month. Since then, they have taken off to help people who need immediate emergency care 6,733 times. Air Care is one of the best in the business because they do something most emergency air services around the country do not do. Air Care has a nurse and doctor on every flight, along with state-of-the-art equipment.
It's a lot different working on a patient in the pseudo-controlled environment of an emergency room as opposed to going out in the middle of a field or the middle of a highway when it's raining or snowing and trying to assess and stabilize a patient from that end. So it's a good educational opportunity for us. For the patient, obviously, you're bringing them a level of care that they would not have available to them readily.
Attention, George 91. On the lot of Johnny's Toys, 60 F1 Street.
This is how the Air Care system works. The Air Care dispatcher at University Hospital is told that an emergency exists. The crew is alerted. A doctor and nurse are sent on their way. And another doctor can talk to the people at the scene from here at the emergency room. The location of the emergency is plotted as the chopper is preparing to take off. The doctor, nurse, and pilot are usually the only people who climb on board. The nurse usually carries blood. All the other equipment they need is inside. 2 patients can be rescued in this helicopter. From the time Air Care gets the call to the time they take off is about 6 to 8 minutes. Now, this thing will cruise at about 150 miles an hour. That means it can get to Falmouth, Kentucky in about 18 minutes, Lawrenceburg, Indiana in about 10 minutes, and Milford, Ohio in about 7 minutes. The pilots say no 2 flights are the same.
The landing areas are different. Even if we land in some of the same places, the conditions are different, the winds and things. And going to scenes, accident scenes out on the highway, you never really know what you're going to get into, and day and night. So it is challenging. The flying part of it is challenging.
This is the patient's view from the Air Care helicopter. Every now and then, someone will say they don't want to fly, but most are too messed up to complain. The worst part of the job for the crew is that even Air Care can't save some people who have been mangled in wrecks or blown away in shootings. One doctor said if people would use their seat belts and refuse to drink and drive, it might put the service out of business. The best part of the business is when a patient who had little hope walks out of the hospital door with a smile on their face.
And it doesn't happen often, but it's very nice when you do have whether it's an adult or a child, come back and say, you know, here I am, I'm walking, I'm alive. That's a great feeling. And they come back and say thank you.
Marty Peratt, News Channel 5.
Air Care has helped in more than 1,200 emergency situations already this year. They only refuse to call if the choppers are already in service or if the weather is too bad to fly.
And coming up, Pat tells us how long this rainy weather is going to hang around.
We've all seen TV shows like Rescue 911 and emergency shows that try to portray what life is like for people whose daily job it is to save lives.
Tonight in a special report, we'll take you behind the scenes at a local emergency room as John Mattery spends a day with a man who is truly one of Cincinnati's lifesavers.
You're about to step into the emergency room at University Hospital, where at this moment, an elderly man who was critically injured in an auto accident has just arrived.
1, 2, 3.
Without surgery, he will probably die. But keep your eye on the man who's just now entering the room. He's trauma surgeon Dr. Dan Johnson, and you're about to see why we call him a lifesaver.
How old is he? 75? A 78-year-old guy, entrapment, passenger was DOA.
Dr. Johnson looks at the x-rays and determines that several internal organs are lacerated. He must work quickly, and every move must be perfect.
Take your hand over the spleen, pull it toward you.
He stitches the man's punctured intestines, then stops the bleeding in the lung.
Sheet of gel foam and a pack.
This time it works. The surgery is a success. But the story doesn't always end this way. If you walk with Dr. Johnson on his daily rounds, you'll see accident victims who haven't done so well. You'll see patients like this woman in her 20s who's been in a coma for several months as a result of a massive internal infection. Her condition has yet to improve.
Some of these people just continue to get better. For some reason, she hasn't done that.
Now Dr. Johnson learns she's also having breathing problems.
Looks like there's a new air leak on the right side. Did you see that one chest tube? Yeah, it seems to be leaking a little bit more this morning.
Despite all his success in the emergency room, Dr. Johnson is frustrated.
You try to, do whatever you can to help, to make a difference, but sometimes the changes you make and the interventions and the treatment and therapy doesn't work.
He's never met the woman in a coma, but he now admits to his assistant that she affects him as if she were kin.
It's hard for me to distance myself and step back and look, and, you know what I mean?
You've gotten too close.
Well, yeah, I mean, you kind of, sometimes you lose perspective. You just want so badly for, people to get better.
We don't often see doctors in moments like this, but this case is a heartbreaker.
Obviously, it's much harder to deal with the failures. I'd like to think that I was in control of all of this, but I'm not.
It's a rare moment, but it will pass. There are other people who need him.
Hey, Brent, come on in.
It's now 6 p.m. Dr. Johnson will spend an hour with his wife and 2 children for dinner before returning to the hospital. His family is happy to see him, but he remains troubled by the tragedies he's seen all day.
You lose sleep. You take things home with you, and, your family does not understand that, this is that Dad's here, but Dad's really not here. Dad is off somewhere and, in a fog.
So why does he do it? Because amid all the suffering, he finds hope. He finds it in people like Al Barrier, a truck wreck victim who was saved on Dr. Johnson's operating table.
I shudder to think what might have happened. I don't think I'd have made it. I don't know what else to say about the man except that he really saved me. I consider the man saved my life.
Do you consider yourself a lifesaver?
Well, no, I don't. And that's probably not what you wanted to hear. But I think that I can't, first of all, I can't do this without the help of the Lord. I mean, that's my feeling. This is, that's where I get my gifts and talents and those sorts of things come from above. And beyond that, I can't do any of this without all of these people you see around here.
University Hospital's assistant chief trauma surgeon knows that for every frustrating case, there's another case that brings joy. And that's what keeps Dr. Dan Johnson going. The knowledge that tomorrow someone else may be injured, and that he's been given the gifts and the hands to help. He's certainly an extraordinary man, but as remarkable as Dr. Johnson is, he's still just one link in a chain of people who are out there to help us. Tomorrow, in the second part of our special report, we'll ride along with some local paramedics in University Hospital's Air Care helicopter. Those are some of the other people, Carol, who should be very proud to call themselves the lifesavers.
That's interesting. You know, Dr. Johnson also seems extraordinarily modest for somebody.
If you think your job involves pressure, just wait till you meet some of the people we're about to introduce you to.
We're talking about the people who stand by 24 hours a day to help us in an emergency. In a special report, John Matarese and photographer Chick Poppy introduce us to some of the local heroes we call the lifesavers.
September 12, 1992. In the blink of an eye, two cars collide on a busy I-275. For the people involved, nothing, not even life, is a sure thing anymore. The driver of one of the cars, a 23-year-old man named Samuel Morales, has serious internal injuries and is losing blood fast. He needs help urgently from the people we call the lifesavers, the doctors, nurses, paramedics, and EMTs who are standing by 24 hours a day for crises just like this.
Here too, okay, we'll show you off 1 minute ago. And
15 miles from the crash scene, a doctor, nurse, and pilot race in the sky across Cincinnati aboard University Hospital's Air Care helicopter. They land right on the highway. Flight nurse Diana Deemling, she's the one on the right, is prepared for the worst.
And we were told that he had a period that he wasn't breathing, that he had to have his airway assisted.
They quickly confirm that the injuries are severe.
It was evident that he had a head injury, and we needed to address that, get an airway obtained, and manage his head injury.
University Hospital estimates that 15 times each week, someone somewhere in the Cincinnati area is critically injured and would probably die if it weren't for the extraordinary efforts of the lifesavers. They have to keep people alive while racing an invisible clock that allows them just 60 minutes to get the patient into the emergency room. 60 precious minutes, known in the medical community as the golden hour. Reading paramedic Stephen Ashbrock has been racing the golden hour for years.
And 60 minutes is one of the time frames that they came up with, is when, despite whatever effort you make for a patient, they still go on to die, even with the best pre-hospital care or even the best surgical care.
And it's a very tight time frame because it's 60 minutes from the time of the accident, not the time paramedics get there.
Okay, we're going to put this on you just because I want to remind you, okay? I know it hurts. I will be real tight, but I don't want you moving your head, okay?
In those few precious minutes, the lifesavers have 3 urgent goals: getting the victim breathing freely, stopping any loss of blood, and keeping the patient from going into shock, a state where the heart and then the whole body shut down. Fortunately, I-275 accident victim Sam Morales does not go into shock. But Diana Deemling and her Air Care team still are not sure he'll make it. Their emergency room is still a slab of concrete, and they must get him to the hospital for surgery before his golden hour expires. So they put him aboard Air Care and head straight for University Hospital, where a race of another sort is already taking place inside the emergency room.
we will anticipate a hot unload here, and surgery will be available.
In every case like this, nearly a dozen doctors and nurses suit up, prepared to operate the moment the patient is rushed through the emergency room doors. The ER team is briefed as they work because the golden hour doesn't wait.
NVA, head on. Driver hit a tree. She was ejected.
Amazingly, the survival rate is 90% for severely injured patients who make it through these doors at University Hospital before the golden hour expires. That's right, 9 out of 10 survive. And Sam Morales from the 275 wreck ultimately ends up among those success stories. But not all end this way. This motorcycle driver is one of those who could not be saved. His bike collided with a car and his injuries were too massive. He stopped breathing before Air Care arrived. And despite their best efforts, he died. But scenes like this are the exception. By living in the Cincinnati metro area, close to hospitals, within Air Care's range, and with trained paramedics in most communities, your chances of getting help before that golden hour expires are much better than for people in many parts of the U.S. And it's people like Diana Deemling and Steve Ashbrock who make the difference.
It makes you feel good. It makes you feel, it reminds you why you're in this business. It reminds you that this business is worthwhile.
In a time of crisis, these people may be our only hope for living to see tomorrow, our only hope for keeping the hands of death away. John Matarese, Channel 9 News.
Oh.
We hope we never need those folks, but we sure are glad they're there.
And particularly given a 9 out of 10 success rate.
That's amazing.
That's real encouraging.
Yeah.
Good job, John and Chick. Well, up next,